Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to discuss the question of, when it comes to knee replacement surgery, can you push your knee and push yourself too hard during rehab and recovery? And the answer is yes and no. So the first thing is I want to think about is a U shape. But we're actually going to think of an inverted U, so an upside down U. And what you want to think about is the level of intensity or the level of stress that you put through your knee and your body with activity, with exercise, with physical therapy. Now, I've talked about this in previous videos. If you do too little, you're not going to do enough stress and give enough stress to your body to cause changes and cause improvements. If we do too much stress, too much force, too much activity, then we're going to cause issues. We're going to cause flare-ups of symptoms, pain, swelling, stiffness, discomfort. So we can do too much. What we want to do is be right at that peak of that upside down U, right at the top of it, where we find that happy medium, where we're providing enough stress and enough activity to the body to see improvements, to see changes, but not too much that we're causing a flare-up of symptoms and discomfort and pain. So, can you do too much? Well, yeah, you can absolutely do too much and cause a flare-up of symptoms, and you can cause pain and stiffness and tightness and swelling. And that's going to cause a problem, because then when you go the next day or later in that same day to do your exercise or your activity, you're going to have a real tough time doing that. And it's just going to set you back, because you're not going to be able to stay consistent with the exercise and activity you're doing, because you're spending this time recuperating from this flare-up of symptoms. So, yes, you can do way too much. Now, are you going to cause an injury? Are you going to cause any damage or harm to your knee replacement? In the vast majority of cases, absolutely not. It takes a real tremendous amount of force, more like a traumatic type of event, like you fall right on your knee and maybe you fracture a bone, to really disrupt or harm your knee replacement. Just, pushing it with physical therapy or doing a leg press or some sort of exercise isn't going to actually damage or harm the knee replacement. What we're more concerned about is that flare-up of pain and symptoms as your body tries to protect itself. It's a natural protection type of reaction. So what we want to do, again, find that happy medium. Find that happy medium, and this is going to change from being a day out or a week out from surgery. It's going to look a lot different than someone who is 3 months out from surgery or 6 months out from surgery. Early on, your tolerance and your ability to tolerate activities is probably going to be a lot lower, and you're probably going to have an increase in symptoms with less activity and less stress. As you progress, you're more likely to tolerate more and more activity for most people. So how do we figure out what this happy medium is? Well, you just have to go out and you have to try it. You have to try these exercises. You have to go to the physical therapy, and it's a little bit of a guess and check, and you have to find where that medium is. If you have a day where you find you did too much, you might have to back it off a little bit. Find a day where it was way too easy, you might be able to push the envelope a little bit the next day. A little bit of this guess and check, adjusting as you go along in this knee replacement journey. Hope you found this insightful. If you did, please be sure to hit that subscribe button and turn on the notifications. That helps to make sure you catch all of our newest videos related to knee replacement surgery. Be sure to leave your comments and questions below, and thank you very much for watching.